The first time that your new baby gets sick, everything feels louder. The breathing, the crying, the clock ticking towards the middle of the night. A tiny cough can spiral into big fear, and suddenly you're wondering, is this normal? Am I missing something? Should I be doing more? So welcome to our chat today on where we cut through the noise, the late night Googling and the worst case scenarios that ping through all of our minds.
But I just knew something was really wrong with him. And actually, when I look back at the pictures, he was pretty grey. And I think it was probably that was shouting at me.
We're joined by Dr Rachael Barr, who's here to bring calm, clarity and evidence-based guidance to one of the most stressful parts of early parenthood, when your baby isn't well.
And that's terrifying, right? Your baby just stopped breathing for a couple of seconds. And they were breathing really fast, and they're doing this weird thing, and you're not really sure. And so parents, will often bring them into A&E and be like, I don't know, they're doing this weird thing. Like, what is this?
Oh my goodness. We now are solely responsible for this little life that we love more than we could possibly ever imagine.
I'd worked in that NICU as the doctor who admitted my baby, kind of thing. I knew all the staff, I knew what was happening, I understood the blood results, I understood, in theory, everything. It didn't really help.
This is a conversation for new and expectant parents who want clear answers, not panic, and confidence instead of confusions. Before we get into this week's episode, there is something I've been waiting to tell you. I'm really excited to share that I am the resident midwife for the Baby Show in 2026. And I will be live at the Baby Show, NEC Birmingham, sponsored by Pampers, from Friday, the 8th of May, to Sunday, the 10th of May, the NEC Birmingham. I'll be on the live talk stage sponsored by Tommy Tippy and Boots Parenting Club on Saturday, the 9th of May at 3 p.m, sharing tools and techniques that you need to support you during labour and birth. The Baby Show is the UK's largest and best loved pregnancy, baby and parenting event, running since 2002, where visitors can buy, compare, try and save from over 350 brands, as well as gain invaluable expert advice, all under one roof. They know a thing or two about babies. Tickets can be bought online at thebabyshow.co.uk/NEC, thebabyshow.co.uk/NEC. And if you pop the code PTPIPPOD, that is PT PIP PIP pod POD, before Thursday the 7th of May at midnight, you will be able to save over 25% off your on-door tickets. So please get yourself a ticket and come and say hi. I would love to meet you. And now, back to the episode. So welcome, Rachael. And thank you so much for joining me, because we were just talking about the fact that we are, as parents ourselves, in the peak of the child baby illness as well. So we feel it deeply.
Yeah, thank you so much for having me. It's so great to join you today. And yeah, we are properly in the thick of it. So I have a 3.5-year-old and a 13-month-old. And I was just saying that we have been battling everything and anything that you can think of since starting nursery a couple of weeks ago. But they are both well today. So yay.
You have to just take those as the winning days, don't you? Because you don't know how long those days are going to last for. 100%. Rachael, talk to me about what led you to become a paediatric doctor, because there's so many different specialties that you can go into in medicine. And we're very lucky that you are in the area of looking after our precious little people. But why was that your area of interest?
Oh, do you know, I always knew I wanted to work with children, and I guess I was drawn particularly to paediatrics for a couple of reasons. The first is that people will often say to me, like, don't you find paediatrics really sad? Isn't it really sad? And I'm like, actually, no, a lot of the time. Like, yeah, of course, there are sad things that happen, really sad things, but a lot of the time, it's a super happy job. Like, kids are amazing. They bounce back so quickly. They can be flat as a pancake one minute, and the next minute they're out, trashing the hospital playroom. And I love that about kids. There's no kind of lying there, woe is me. Like, as soon as they feel better, they're up, they're off, they're gone. And the other thing is that I love the fact that children come with this whole group of people who just love them more than anything, more than life itself. And it's amazing to have a patient who has this group of people who are advocating for them and know everything about them and love them and want to take them home. And you don't get that so much in other areas of medicine. So I love those two things about pediatrics.
Oh, I love that. And you're so right. Like children are the most resilient little things, aren't they? Like they are just amazing. And so precious. So we are so grateful to people like you looking after them. But from a parent's perspective, why is it that baby illnesses feel so overwhelming for new parents? I guess even when sometimes the symptoms are mild, but when you're there, like I've definitely been there, when you're there with your new baby and they've got some kind of cold or snuffle or some kind of illness, it feels huge, doesn't it?
It does. And it's this really overwhelming thing. You're suddenly handed this brand new entire human and told you can go home, and they're your responsibility now. And that's a huge change that I don't even really know how to put into words. And so it's kind of unsurprising that when you get home and something's not quite right, all of your evolutionary instincts now are designed to keep this tiny person safe and alive and well. You know, that's how we're programmed to survive as a species. So your brain is in overdrive looking for threats, looking for injuries and illness and problems so that you can head them off at the pass. And so I think a lot of new mums and dads, their brains are totally in overdrive when they've got this new baby at home. And so even little things feel like really big things. You know, your cortisol is probably sky high, your adrenaline's sky high. And the other thing is that objectively, babies do quite a lot of slightly terrifying things.
So true.
So, you know, even doctors who aren't pediatricians are like slightly frightened of babies because they do all this stuff that you're a bit like, what was that?
What was that
normal?
noise? What was that movement? Yeah,
Exactly.
so true.
So yeah, I think those two things combined just don't make it a calming experience all the time.
It's so hard as well, isn't it? Because they're so small and vulnerable and they can't communicate properly with you and they cry for all sorts of reasons. It can feel so kind of confusing. And I often think, Rachel, it's nuts that whenever we have like a big role or a big job or a big transition in life, there's like training and interviews and someone like qualifies you for it and tells you, you've done the courses, you've got the badge, you can do this. And I remember with our first, coming home with him and being like, oh my goodness, we now are solely responsible for this little life that we love more than we could possibly ever imagine. And I remember even as a midwife, and like the newborn bit was the bit I kind of knew, I kind of knew what I was doing in that bit. But even then, like that overwhelming responsibility of like, this is now 24/7 and I am responsible for every single thing for you. Like, it's huge. And you're suddenly like, can I do this? Do I know this? And it's really hard, isn't it, as a parent to be like, am I ready? Am I qualified? Has anyone checked that I'm ready to kind of take the steering wheel and pass this test?
Yeah, totally. And like, I think people often think that maybe someone like a midwife or a pediatrician has like had that training, and so we must be totally calm all the time and know exactly what we're doing, and it's just not true.
Absolutely not. No. Winging it every day.
I was terrified as well when I took my first home, and my eldest actually went to neonatal intensive care for the first few days because he had some issues with his breathing and wasn't very well. I was petrified. I'd worked in that NICU as the doctor who admitted my baby, kind of thing. I knew all the staff. I knew what was happening. I understood the blood results. I understood, in theory, everything. It didn't really help.
It's so true. And sometimes it's almost worse because you've seen how quickly things can change, as much as you know that they're in the best hands. If we think about like the common illnesses that you tend to see or parents tend to present to you with, Rachel, what ones tend to kind of cause the most fear unnecessarily in parents?
Yeah, so unnecessarily. So I guess common things that we see in newborns specifically is often things around feeding and like loosely related to feeding. So they'll often lose a little bit of weight to start off with, and then maybe they're not gaining weight as well as we would hope. They're not feeding as well as we would hope. Maybe they've had some low blood sugars. Maybe they get some jaundice because, you know, they're just getting going with their feeding. And then the other thing, I guess, is viral illnesses, coughs and colds, which can obviously be more of an issue in a newborn compared to an older child. But I guess things that kind of worry parents unnecessarily are more the kind of normal things that babies do, like I said, that are actually slightly terrifying, even though they're normal. So I think like a really good example that I see not infrequently in A&E is something called periodic breathing. So you'll know all about this, but babies do this like horrifying thing because they've got immature breathing centers where they kind of breathe really fast for a bit. So they go, and then they stop.
They stop. And you're there watching them like, breathe, 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 please breathe.
Yeah. And it feels like forever, right? But it's only a few seconds. If they stop for longer than that, that's a problem, obviously. But they pause for like a couple of seconds and then they go, and then they go back to normal. And that's terrifying, right? Your baby just stopped breathing for a couple of seconds and they were breathing really fast and they're doing this weird thing and you're not really sure. And so parents, will often bring them into A&E and be like, I don't know, they're doing this weird thing. Like, what is this? So I think things like that, if no one's told you that that's going to happen, then yeah, that's really worrying.
Really scary. Yeah, absolutely. And I think that startle reflex, I often get videos from parents of like that startle reflex, which again is really normal, but can almost look like they're twitching strangely, or parents will be worried they're having some sort of seizure, but it is just that like sudden movement and then they're relaxed. And usually they do it when they're asleep as well, don't they? Which is kind of what makes it feel even more odd, because you think, well, they shouldn't be startled, they're asleep, but they're funny little things, aren't they? And we watch them like, you watch a newborn so much more than you watch, perhaps a 6-7-year-old. So you notice all of these tiny things they're doing and you haven't figured out them yet. You're still learning who they are. So it's such a tricky time, but it's so important that, parents know that it's also absolutely fine if they present with their baby because they're concerned and their gut instinct is that they're not comfortable. Always listen to that. I'm sure you don't mind, Rachel, saying to families, oh yeah, that's really normal. This is what this is. Off you go home. Everyone has a better night's sleep, right?
Absolutely. Absolutely. I would always, always, always rather see parents who are sitting there terrified in the middle of the night, not sure, and tell them it's fine, it's this, you're fine, go home, than have you sit at home worrying about something that actually did need seeing.
Definitely.
And I don't know any pediatrician who doesn't feel like that. So
absolutely, which is so reassuring, I think, because everyone's always so worried about like wasting time in the NHS, but like these are precious little people and you totally get it. Like you totally get you'd rather check them 100 times and not miss something.
Absolutely. Yeah.
Now, when we talked about that gut instinct, which obviously is so important and always listen to that for sure. But when is there that difference between this could be normal, but I'm not quite sure, maybe I'm going to watch and wait as a parent, and then that kind of this needs medical attention now? What are the kind of like red flags that parents should be aware of that actually this is a time to go and see the likes of you in A&E as opposed to kind of just waiting at home and maybe getting a GP appointment the next day?
Yeah, it's hard, isn't it? And I think, the first thing to say is that no one's expecting parents to be medical professionals for their newborn. No one's expecting you to have this extensive level of knowledge. And as I already said, even if you do have this knowledge, somehow when it's your own child, there's a very good reason we're not allowed to be doctors for our own children, because it's impossible to be objective for them. So take a little bit of pressure off of yourself. No one's expecting you to know everything magically all of a sudden. As you say, you should trust your gut, and that's not just us saying that off vibes. There's actually really good evidence now that your parental gut instinct is a super important clinical tool and actually performs better in some studies than like observations, heart rate and breathing and blood pressure and all of those things. Gut instinct does better at spotting sick children than all of that clinical stuff. So it is really important to listen to that part of you that's saying something's wrong. And it's hard to give a list of kind of everything that could possibly be a problem. But in newborns, it's maybe a little bit easier because there's only a certain number of things that they're meant to do, right? They're meant to breathe and their hearts are meant to beat. They're meant to wake up and feed and wee and poop. And that's kind of it.
That's it. That's a simple life, right?
It's a simple life. So if any of those things aren't going as you would expect, then it's always worth getting them seen and having it checked through. So if they're, in terms of breathing and heart beating, if they're working hard to breathe, so like they're sucking in under their ribs or between their ribs, sucking in at the bottom of their neck, flaring their nostrils. Newborns do this weird little grunty thing when they're struggling to breathe, which parents often think is a cute noise, but actually, yeah, it's not a cute noise. If they're kind of going,
it's almost, sometimes it almost sounds like they're singing as well, doesn't it? Like
exactly.
It sounds cute, but it's actually a sign that their airway is struggling slightly.
That they're having a tough time, yeah. So anything like that, they should definitely be seen. In terms of their heart beating, the best thing that gives you a clue with that is their skin. So if they're looking very mottled, grey, blue, any of those colours I don't particularly enjoy. So anything like that, I'd get them seen. In terms of waking up, if they're so drowsy you can't wake them up. So we often talk about, stripping babies off and tickling their feet and trying to wake them up in those sorts of ways. And if none of that's working, then they need to be seen. The kind of opposite of that, if they're in so much pain or discomfort that you just can't settle them no matter what you do, that also should be seen. And then it's feeding, peeing and pooping. So if they're not feeding, they're not weeing and having at least 3 wet nappies in a day, say. But pooing is a little bit of a tricky one. They need to have had meconium in the first 24 hours, as you know, so that first poo. Beyond that, it can be, it's a bit more complicated. But if you're worried about their poo in any way, then get them seen. And then the last thing is newborns and temperatures. So any temperature 38 or over needs to be seen as well.
Yeah, that's such an important one. I think temperatures are, again, like that huge source of anxiety. And I always say to families, when you're doing your like nursery planning and choosing your cot, please also make sure you get a newborn appropriate thermometer, because it's really hard to kind of think, oh, have they got a temperature? Haven't they got a temperature? And actually being able to check and have a number and that reassurance at home is so, so important. Around the kind of topic of temperatures, Rachel, would you mind giving like a summary to parents kind of around some of the things that they really need to know, why babies may have a temperature, how their body's responding, and why we're so concerned in that kind of unvaccinated or real newborn period, that first sort of 8-ish weeks?
Yeah, definitely. So I often talk on my Instagram page about fever is not something to worry about in and of itself, and it's more about how the child is. But the exception to that is newborns, right? There's always an exception, and newborns are the exception. And by newborns, I guess, definitely up to 8 weeks, maybe even up to 12 weeks. We are super, super cautious. And there's a couple of reasons for that. So they're unvaccinated, but also they have very immature immune systems. They just can't handle things the same way that we do. They have very small airways, so little coughs and colds can create a bit more of a problem. They also have a really leaky, what we call blood-brain barrier. So all of us have this barrier of cells between our brain and our spinal cord and our blood. So when we've got bugs that are in our bloodstream, it protects our brain and our spinal cord. So it protects those important areas for survival, and stops bugs getting in there. Babies aren't so good at doing that, and so they're just a bit more vulnerable to things like meningitis. And I'm not saying that to scare parents, it's just that's why I think sometimes parents feel that we go quite full on when a very young baby comes in with a temperature, but that's why, because they're just that bit more vulnerable, and the consequences of missing something are too great. So that's why we're a little full on with little tiny babies that have a temperature. So any temperature 38 or over in a baby under 12 weeks, I just get them seen. It may be nothing. It may be that babies aren't very good at regulating their own temperature. Sometimes they can get a temperature just from being wrapped up too warm. But if we see them and we look at them and we monitor them for a while and everything's fine, then that's great. They can just go home again. It may be that everyone else in the family's got a cold, and you're pretty sure that the baby's just got a cold and that they'll be fine. Even if it is that, please just bring them in. Definitely. Really, really, really would rather see them and say everything's okay. The other thing that I think parents often don't know is the opposite, which is low temperatures can also be a sign that something's really not right. So anything 38 or above and anything below 36, I would just get them seen.
Definitely. And that's such a good one, because often there is that high temperature and then we're almost reassured if it's low. And I'd always say as well, make sure you're using a thermometer on a newborn that is newborn appropriate, because often we can get
Absolutely.
false low readings just because of the equipment not working for their tiny, tiny bodies. So you make sure you've got a
Absolutely.
newborn appropriate, and check it a couple of times. If you're like, oh no, they don't, if I think they're all right, just check it a couple of times, but always be seen. And that temperature one is something we've spoken about quite a bit on the podcast, Rachel, because my second son actually had a temperature at 5 weeks and he had meningitis, and we had that real parent gut instinct. It was the middle of the night and we both just knew before we checked his temperature. He woke up screaming inconsolably, and it was that instant gut instinct of something is wrong. And so we followed that, and yes, I checked his temperature as well, but even without that, we knew something was wrong. So always that gut instinct is something we talk about a lot, because like you say, it's so powerful right through pregnancy and right through your parenthood journey as well. So never feel like you can't speak up, or phone like your midwife, your GP, attend A&E, just because something doesn't feel right to you. Sometimes we feel like there has to be a thing, don't we? But actually being like, I just feel like something's wrong is valid enough in our eyes.
Totally. And when my eldest was born, as I say, we had an emergency section, and then we were on the postnatal wards, and he'd been seen by the pediatrician because I'd asked them to come back because I felt he was grunting a bit. They'd seen him, they'd said he was okay, they'd checked his SATs, they'd done all the appropriate things. But I was just looking at him in the cot on the postnatal ward, and I just was like, something is not right. He's not right. And did I really know him? I don't know. He was like an hour old, but I just knew something was really wrong with him. And actually, when I look back at the pictures, he was pretty grey. And I think it was probably that was shouting at me. And that was kind of all I had to go on. He was otherwise objectively fine. His observations were okay. But actually, I asked for him to be seen again. And he was very unwell, and he had sepsis, and he went straight into intensive care. So that's that thing in you that's screaming, listen to it.
Always listen to it. And it's like, we'll have seen it time and time again, won't we, in our practice, Rachel, where there's nothing on paper, everything looks okay, but there's a parent saying, I just know something's wrong. So please always know that, yes, numbers are great. They can tell part of a story, but also numbers change. They change all the time. So sometimes we will just be like, let's just watch and wait, and not send you home or not send you anywhere, but just keep a little bit of an eye. And that can either send us one way or the other. Either we're like, oh, okay, actually you feel reassured, everyone's comfortable, or actually we decide that they do need some support. And I remember a really lovely pediatrician that I saw one time after Alfie had been poorly. As you can imagine, I was then like twitched every time there was anything. And actually he saw him when he had tonsillitis, and he said, I'm happy with him right now because he's in front of me, but as soon as you walk out that door, I don't know what's going on. So I'm only happy while the child's in front of me and I can see them. So if you get in the car and you're concerned, you come straight back in. And I thought, actually, that was really, really nice to know that no one is going to be thinking, oh my goodness, they're here again. This is your precious little life. And if you need to get them seen 10 times, or bravely say, actually, would it be okay to get another opinion? Those kind of things are absolutely fine. They're not you being fussy. I've had a GP actually, he said to us before, do you know what, I'm not sure anymore and I want him to be seen by somebody else. So that's okay. We're all human, and we'd rather double check with a colleague than a parent go home feeling not 100% yet.
Yeah, and a lot of my colleagues often say observation is an investigation. So what they mean by that is like just watching a baby for several hours can often give you like super important information, like you say, of which way you're going. So don't feel that if you've come to hospital and all we've done is watch, that means that you shouldn't have come. That's not true at all. We've done a really important investigation. We've watched and monitored and seen how things have evolved. And I will also, I try and use the phrase with parents before they're about to go home, especially with newborns, how do you feel about going home? Because I think it's important that we're on the same page at that moment in time, that you feel confident and happy, as well as me, because you're the one who's got to take them home. So
Yeah.
I'm very open to parents saying, especially if it's 10 o'clock at night, actually I don't feel good about this. I would much rather you say that to me, and we can often find a place to keep you in, and go home in the morning, and I would always rather do that than have you go home terrified to be sat up all night staring at them.
Yeah, absolutely. Because sometimes being up with your baby is scary enough, isn't it? Without even, without anything else going on. So if they are unwell, it's even more worrying.
Yeah.
And is there any kind of advice that you find yourself giving, maybe like patients, parents, but also perhaps on your own parenting journey, to try and stop that second guessing? Because I feel like we've all done that, haven't we? In the middle of the night, maybe they've woken up and there isn't particularly anything wrong, but we just start our mind spiraling into, oh, is this happening? Is that happening? Could it be that? Is there any kind of advice that you find yourself using as a mum, or kind of giving to parents with that kind of constantly second guessing yourself?
Yeah, it's difficult, isn't it? I think my main thing would be that I try and say to parents, especially with older children, to try and aim for calm first. So these things always happen in the middle of the night, right? They happen at 3 o'clock in the morning, always. And everyone's very tired, very stressed. It's dark. It all feels really overwhelming in that moment. And so I try and, obviously there's situations where you just need to call an ambulance and that's fine. But actually a lot of health sits in that grey area where you're like, I'm not really sure. Can they stay at home? Do I just see the GP? What do I do? So I try and take the pressure off making a decision right now. Let's just aim to calm everybody down. And by everybody, usually me.
It's usually us. Yeah.
Yeah.
100%.
The child might be asleep, but like everybody needs to calm down. And so whatever that looks like for you, whether that's turn the lights on, turn the telly on, turn the radio on, make it all feel a little bit less claustrophobic and overwhelming. Have a drink, make a cup of tea, whatever it is you need to do to just bring yourself down. Especially with things like, in older kids, things like croup, where it can sound all really terrifying. And actually, if you just have a cold drink and watch them Bluey, everything gets a lot better.
Yeah.
And then you can have another look at them. And often that's all you need to be like, okay, this is okay. Objectively, nothing has changed from when I was seen earlier, or, whatever. Sometimes that little moment is just all you need to bring yourself back to earth again. But then I would say, if it's still not clear, use the resources that are out there. There's so many of them in lots of areas. I don't know, you probably know better than me whether this is true in all areas, but I know where I am, you can, when you've got a newborn, you can phone the midwives for quite a long time after they're firstborn,
absolutely. And even
advice.
if you're slightly out of their threshold, they will then signpost you to somewhere else. So if you're thinking the only contact numbers I can remember is the maternity triage or the postnatal ward, and you're like, I don't think that is the right place, but equally I don't know where to go, well, phone them and then they'll say, I'm going to pass,
they'll send you. Exactly.
Yeah, like everyone is still, it feels lonely, doesn't it, I think, when you first get home, but those people aren't in your home, but they are still your port of call and your resource.
Totally. So there's that, there's 111, which I know parents have mixed experiences with, but actually they can be really great. The other thing is there's like the Healthier Together website. Not every trust have it, but lots of trusts use a thing called Handy App, which is an app that the trust pays for and then you can use for free. And they have a newborn pathway on there, which has like common newborn problems that you can just click through. And it'll ask you like, do you have this or this? Yes or no. And it'll often signpost you. As I say, not every area has that, but a lot of places do. So it's worth having a look at that. There is lots of help out there. You're not on your own. As you say, it can feel really lonely in that moment, but you're not.
Absolutely. Yes. That's such nice, reassuring advice. And if you could give parents, if they took one thing away from this episode and from listening to you, Rachel, what would be the one bit of reassurance or advice around baby illness that you would just want them to really hold on to and to believe as they go through their journey?
Yeah, I was thinking about this, and I was trying to distill it down to one thing, and I managed to get it down to two, so I'm going to do two.
We'll go with two. We love a little rule break. That's perfect.
The first one is that you do know your baby. You do. Even when they've just been born, there is something weird that I can't explain about your relationship with your baby. And you know them so well, so quickly. And even if you are a mum who doesn't get that like immediate, overwhelming sense of love, which I know lots of mums don't, you still know them. And so trust yourself that you will know when something is wrong, because you will. And the other thing I would say is kind of what we talked about earlier, which is that I don't know a single pediatrician who wouldn't rather see you and reassure you for something that isn't a problem compared to missing something that was a problem. So I just would encourage you to always reach out for help if you're sitting worrying about something, in whatever way that might be, whether that's the GP or the health visitor or the midwife or the pediatrician, whoever it is. Speak to someone. Don't just sit there and panic.
I love that, Rachel. It's such lovely advice to close on. And yeah, I love the idea that you do know your baby even before you maybe realize it. You are always going to be their expert, and your thoughts, your feelings, your gut instinct is going to tell a bigger story than anything else. So listen to it and vocalize it and be empowered by it. Thank you so much, Rachel, for giving up your precious time to help
No, thank you for having me.